Working together to make a better community.
Welcome to Community Conversations. I'm your host, Steve Mantis, and my guest today is Sally Colquhoun, the Co-ordinator of Legal Services at Kinna-aweya Community Legal Clinic. Welcome, Sally.
Thanks, Steve. It's nice to be here.
So, Sally, just tell us a little bit about yourself and how you ended up there at Kinna-aweya Community Legal Clinic.
Well, I'm from Thunder Bay originally. I grew up here and went to high school. I went away to university and went to law school in London, Ontario. And when I was looking for a job, when I got called to the bar, there was a job opening at Kinna-aweya Legal Clinic. I didn't know anything about clinics at that time. They were still pretty new. The Kinna-aweya had been operating for about 6 years at that point, and it's 45 years now. So so I took the contract job for 6 months, and it was a really interesting place to work. It was a really great workplace. And then I was in private practice for a few years when the contract ended, and the clinic got funding to hire an additional lawyer, and I applied to come back. So I've been back here full time since 1987. So through lots of changes in programs that our clients deal with, and just in the community. But Kinna-aweya has been a consistent presence in the community since 1978.
And you've been there for almost, from 78 to 87, I guess. And
No, 84, 87 to, I've been here about 34 years. So.
Right on.
we've had lots of long-term employees because it is really rewarding work, and it's a good place to work. Legal clinics are funded by Legal Aid Ontario currently, and most of that funding comes from the Provincial Ministry of the Attorney General. So we're thankful for that funding at the legal clinic. But we're also all independent corporations, nonprofit corporations. So there are general service legal clinics in most communities in Ontario or districts. So a Kinna-aweya Legal Clinic provides service to low-income people throughout the district of Thunder Bay. We have an office in the city of Thunder Bay, but we also have offices in Geraldton and Marathon. And the legal workers who live in those communities travel around to First Nations communities and other smaller communities in their catchment areas. We originally we used to have an office up in Armstrong also, but that unfortunately was lost to administrative savings a number of years ago. So that area is now serviced from by staff from Thunder Bay going up there. But from the beginning, there's been a recognition of the need to have a service that is going to provide direct service throughout the district, not just in the city of Thunder Bay. And back in the 70s, it was a group of Indigenous people who saw that need and applied for the funding to open a legal clinic. And Ontario Legal Aid Plan, as it was in those days, said, well, all right, we'll fund your clinic, but you're going to be the only clinic in the district of Thunder Bay. So you have to provide service to everyone, to all low-income people who come within our financial eligibility guidelines, who have a problem of the type that we're able to help with. And so while we have the structure of the clinic is focused in the Indigenous community, we do provide service to all low-income people. And Kinna-aweya is actually the Ojibwe word for everyone. So we provide service throughout the district.
And so, Sally, you mentioned there's an eligibility for people on a low income. Now, what's the threshold there?
It depends on the size of your family. So, but it's, basically, we have the same financial eligibility guidelines that Legal Aid Ontario have for their other programs. Legal clinics are just one small slice of legal aid services in the community. All criminal matters and family matters are dealt with through their certificate program, or through staff duty council, that are staff of legal aid. And so if somebody has a criminal law problem, they apply for the legal aid certificate, and they can take that to a lawyer who takes legal aid certificates, and the lawyer gets paid by legal aid. So there are financial eligibility guidelines for all of the legal aid programs. We have to apply them if we're opening a file for somebody. But a lot of the work that we do are for low-income people who are on social assistance. So it's not really. I mean, most people who contact our office are financially eligible, but there are some of the areas that, like Canada Pension, we have to be more. You might be more likely that somebody has a spouse who's working and might not be financially eligible for our services, but we can still give them information and advice. So we do intake every week of new matters to give people advice or assistance, often just information and advice. If it's a matter that we can open a file on, we will open a file and represent individuals. And then, but in addition to that individual casework, we also have a mandate to do law reform work and community development and public legal education. So it's a really broad mandate that legal clinics have to provide a range of services, not just individual casework. And really, that's the only way you can keep doing this kind of work, as you know, for the community work that you've been doing for decades. If you're just dealing with individual problems, it can become very overwhelming when you see person after person with the same problem. And so it's really important that we have some time to spend trying to improve the program for everybody, not just the one person who's been able to get into our office and we've been able to successfully win an appeal at the Social Benefits Tribunal for them.
So you're in an ideal location in a way to be able to determine when there is kind of a systemic issue that could be improved for everyone, because you see a number of cases in the same area.
That's right. So, for instance, a number of years ago, we were seeing a lot of women coming in whose Canada Child Benefit had been suspended, or they had overpayments. And we were helping those individual people deal with the problem that they were having, that they'd been selected for a random review by Canada Revenue Agency and received a 9-page letter asking for a number of documents, that many of which were impossible to provide. And because they weren't able to provide them within the short time limit that was given, their Canada Child Benefit was cut off, which is it's really serious problem for a low-income person, because parents who are on social assistance in Ontario these days do not get any money for their children from social assistance. It now all comes through the federal Canada Child Benefit and the Ontario Child Benefit, which are paid through the Canada Revenue Agency. So if your Canada Child Benefit gets cut off, that means you're not getting money for groceries to feed your kids. And so we were seeing a number of women coming in that clearly had custody of their children, and nobody else was challenging that they were eligible. But because of this random review process, they were getting cut off. And one of our clients, got it when we were finally successful and got her back on. She got a retroactive payment of like $65,000, which seems like a huge amount. Except if you think about it, she should have been getting that money every month for the last 3 years to provide benefits for her, to pay for shoes and groceries for her kids. So we did some community work about that. We met with the members of Parliament, and we ended up having a meeting with the Minister of Revenue, and that some of the problems with their random reviews seem to have become less of a problem. It's hard to know exactly what the connection is, but the systemic work is really important. It's always a challenge for our staff because we've always had capped funding. We just have a certain amount of money, and that's all we get. And we have to figure out priorities of what we're going to do, and that's where our volunteer board of directors comes in to help us set priorities. And that's where it's a real advantage for community legal clinics to be embedded in their communities, because the priorities that are set by Kinna-aweya Legal Clinic in Thunder Bay may not be exactly the same as the priorities that are set by the West Scarborough Clinic in downtown Toronto. Well, not downtown in Scarborough, but because you've got a different client group, you have different issues. And so that's been a real strength of the clinic system, is that we're really embedded in our communities, and we're able to respond to our local community issues. So for instance,
So,
sorry.
no, I was just going to say, so in terms of that connection to the community, one of those connections I know is your board of directors. Um,
Yes.
Tell me a little bit about your board.
So our board of directors, our corporate structure is in order to be a member of the corporation, you have to have Indigenous ancestry, and you have to be a member of the corporation to be on the board. So all of our board members are Indigenous people, and they also are they're from throughout the district. So the corporate structure is that we have 3 board members from Thunder Bay, but then 1 each from Nipigon, Marathon, Geraldton, and Armstrong areas. So we get that direct input from those more remote parts of Thunder Bay District, not just from people in Thunder Bay. And, we can pay the expenses for those board members to come to board meetings. And of course, like everyone else, we're doing them on Zoom these days. But we also, they're elected in their communities. So the board member from the Greenstone area is elected at an area community meeting in the Greenstone area in September. And at the same time, there are 4 members of the community who are elected to come to the annual general meeting of the legal clinic as voting delegates. And so when we're doing our AGM, again, we're not just getting feedback from people who live in the urban area in the city of Thunder Bay. We're getting feedback from throughout the district. So that's been a really important part of the way that the clinic has been structured over the years. And the board of directors, like most nonprofits, they focus on higher level policy setting and setting policy and priorities. And so it's really we have a lot of community input into the work that we do, and then also through our staff, because we're involved in lots of different community organizations. So for instance, the New Direction Speakers School, Kinna-aweya Legal Clinic was one of the original sponsors of that program, and we have a staff member who's on that board of directors. And we're involved in all sorts of community organizations throughout the district. One of our staff members is the current chair of the Urban Indigenous Advisory Council that deals with the federal homelessness funding for the urban Indigenous population. One of our staff members is a board member on the Greenstone Harvest Center, the food bank up in the Geraldton area. We're involved in lots of different community organizations. We've actually, we had funding for 3 years through the local poverty reduction strategy for an ID services coordinator, because that's something we've been working on for years to try to help our clients get necessary identification, government issued identification, so that they can get social assistance and they can get on the wait list for subsidized housing, and they can get a health card and get medical treatment. There are all sorts of problems that people have if they don't have ID. They can't get a bank account. It's a problem for them to get their social assistance. So there's a lot of need in the community, and we were able to, through that program, start like develop community capacity. There's now an ID action group that with a number of different people from a number of different agencies that are working on this issue of making sure that people get ID in an and sometimes the cost of it is prohibitive, and sometimes it's a problem because they need some assistance with the whole process.
So while you're providing legal information and support and representation, the impact, it sounds like, is much wider than in that kind of legal area. We know that the determinants of health, that deep poverty is one of those areas that oftentimes translates into poor health. So, and I can see now during the COVID time, if you're not able to be housed and supported, you're at higher risk of contracting the disease, and through community transmission. So in a way, you're helping to keep our community safe through your efforts in the legal realm. Did I get that right?
I think that's correct. The areas of law that we focus on in the work that we do are income maintenance and eviction prevention. So all of the government income maintenance programs like Social Assistance Ontario Works, Ontario Disability Support Program, Employment Insurance, Canada Pension Disability Benefits, they all have appeal processes and administrative tribunals that hear appeals. And so we actually represent people at a lot of those, in a lot of those appeals. And then we also do represent tenants at the Landlord and Tenant Board. And you're right, the social determinants of health do show that there's a big link between living in poverty and having more serious health problems and a lower life expectancy. And unfortunately, over the years that I've been doing this work, people are living in it's become deeper and deeper poverty. People on social assistance get less today in actual dollars than they received in when I started doing this work in 1987, in terms of actual buying power and how much rent is. A single person on social assistance on Ontario Works right now gets less than $400 a month for rent. Well, you can't even rent a room at a motel on Cumberland Street for that much. And so it's it's really challenging for people to try to make do on the little amount of money that they get. And so that's one of the reasons that it's important for us to do the bigger systemic work as well, and try to advocate for better programs and more assistance. Because the ironic thing is, I mean, it's better for the community if you don't have people that are living in desperate poverty. It's better for the community as a whole, and it's cheaper for the community as a whole, because you don't have there's you have fewer visits to the emergency room, and you have better outcomes for kids in school if they're not living if their family's not living in poverty, and over the long term, it saves a lot of money. It's cheaper actually for somebody to live in an apartment in the community than to stay in a bed at shelter house. It's actually cheaper per month for them to have an apartment. But because the way the programs are set up, that's not always possible. And the lack of affordable housing, and there's all sorts of reasons why that is. But we do our best to juggle all of these competing demands, because there are more things that people would like us to do than we are able to do, and so we are always juggling competing demands. It's hard to say no to somebody. If some individual comes into the office and says, I have a landlord and tenant board hearing, I'm going to get evicted from my subsidized housing unit because I haven't been able to do my annual verification form because I can't afford to get my bank statements. I mean, we have to help that individual. And so you can't really say to that person, well, sorry, nobody can help you because we're all busy going to a meeting talking about the lack of affordable housing. And so it is a constant, there's constant tension between the need to do the bigger systemic work and the individual casework.
And in a way, I'd like to ask, kind of, now you've been involved here for almost 4 decades. The clinic's been around for longer than that. What have you seen changed over that time in terms of really our public supports to people who need them? We work, I've been active in working with academics to try to understand these issues. There's a fellow, John Stapleton, who worked for the Ministry of Community and Social Services, now retired, that has coined the phrase welfarization of disability. We know most of the people who are homeless have one kind of disability or another. We see in workers' compensation over the last 10 years a move to reduce the costs, pretty much 50% they've reduced. Those people still need to live. They end up turning to some of the programs that you, I guess, deal with closely. What have you seen over those last 3 or 4 decades in terms of how we're going in terms of support to those most vulnerable in our communities?
Well, we're providing less support to those most vulnerable people in our communities. I mean, there are lots of good programs now that didn't exist, but when you look at the basic social assistance amounts are so inadequate, and they didn't. I mean, they've never been generous, but you used to be able
No.
to rent an apartment and have a phone and buy a newspaper to look at the want ads if you were on Ontario Works, and have a bus pass and eat, buy groceries and cook your own food. And now lots of people, I mean, you look at the numbers of something like the Dewdrop Inn soup kitchen, then every year the numbers go up and up. And that's because people don't get enough money to pay rent and buy food. So they have to take advantage of these charitable endeavors, which are great. And I'm not, certainly not saying that we shouldn't have charitable endeavors, but people on social assistance should get enough money to pay rent and buy food. They shouldn't have to rely on charity to get food. And those things are worse now. There is more homelessness. There's more food insecurity. There's worse health outcomes for people. Things, and then just as you mentioned, the whole welfarization of disability, so that people who are injured at work can't get the WSIB benefits that they should be getting. They end up on the provincial social assistance, and it's there's lots of ideological things. So there was a basic income pilot project that the provincial government started in 2015 or 2016. I can't remember exactly when it started. And it was intended to be for 3 years. People were going to get money for 3 years. And there was a really robust academic component of surveying people and getting really good information about what happens if you do a basic income. And before they started it was the Liberal government. They had meetings with the NDP and the provincial Conservatives and said, we're going to start this 3-year pilot project, but there's an election coming up in 2018. We don't want to start the pilot project if we end up not winning the election and there's someone else in government. And the other party said, oh no, we think that's a good idea to do this pilot project. We'll continue it. And then there was an election in 2018, and a few months later, bam, the program was canceled without ever having been any discussion about it. So there's a lot of ideological resistance to the really good academic research that shows that the entire community is healthier if your most vulnerable people have enough money to meet their basic needs.
And kind of in the last couple of minutes, what advice would you give to residents of our community who wanted to join in with Kinna-aweya to try to address some of these systemic issues in our society?
Well, there are lots of there's a group called Poverty Free Thunder Bay. That's a group of people from the community who are interested in dealing with these issues on a more systemic basis. The city of Thunder Bay has a poverty reduction strategy, but a lot of it. I mean, we can do that work locally to try to advocate, but the change has to be made at different levels of government. So when you have a provincial government who has someone say, well, the fastest way to get out of poverty is to get a job. I mean, they clearly do not understand the barriers that people who are on social assistance have to being involved in the workplace, even if they don't have disabilities. And there's so many hidden disabilities. People who are too disabled to actually get through the application process to apply for disability benefits. So there is lots of work being done in the community. And we would certainly encourage anybody who's interested in those issues to consider speaking up about it.
Sally, we're just about out of time. If people want to find out more about Kinna-aweya and the work you do, what's the best way for them to get in touch?
Well, we have a web page, which is www.kalc.ca, and we also have a Facebook page at Kinna-aweya Legal Clinic, KINNA-AWEYA.
Sally, thanks so much for coming on the show. Sure appreciated this, and it's always good to talk to you, and I really strongly support the work that you're doing there at Kinna-aweya. I want to thank our audience for tuning in and engaging with us. We do have a Facebook page, Community Conversations. We always look for your ideas of topics to cover and any feedback from the guests that we have on the show. Thanks again for tuning in, and we hope that this pandemic's going to wrap up pretty soon in 2021 anyways. We hope everybody stays safe and healthy as we move forward. Thanks again, Sally, and stay safe yourself.
Thanks, Steve. Nice to see you.
Working together to make a better community. We can create a brighter day.